welcome everyone. I made today's video specifically to say thank you for 2,500 subscribers. So again, thank you. This is the longest video for sure that I have ever made on my channel. So if you could please leave a like and also hit that subscribe button. That is all I ask from you. And again, thank you all very much. I hope you enjoy and stick along for the ride. This should be relaxing. Enjoy. Okay. I do believe my 5 o'clock should be coming in here right about now. Hello there. How are you today? Not too good? That's quite understandable. I do know why you're here today. Well, my name is Jalen, and I will be the doctor taking care of you. It is a pleasure to meet you. You can just call me Jay if you like for short. So today you are here for an ear exam, and we're also going to be doing a hearing test, and depending on the results of the ear examination, we may also do a little bit of an ear cleaning for you today, if that's alright by you. Okay, just making sure you got enough time and you're fine with potentially doing a little more to make sure your ears are in tip-top condition by the time that we let you go today. So, before this all gets started, are there any questions that you have for me? Okay. Alright. I'll just guide you along as we go through everything, but I actually have some questions for you now, before we get started with anything hands-on. Okay, so let me, hold on, first put in some information here. Okay, know how to spell your name. Alright, now do you have a phone number that we can contact you at? Okay, and what about an email? Okay, got it, and that is at dot, okay, very good. Let me make sure, got that in there? Okay, that's all I needed. So now, questions for you. So can you just describe to me what has been happening here with your ears and with your hearing? Okay. Alright. I see. Okay. Yeah. Alright, I can see how that could be pretty annoying. Okay. Alright. Well, don't you worry, we're going to try and get down to the bottom of this. So, first question I have for you, have you been experiencing any kind of earache since this problem has started? Okay. Now, next question, is there any sort of ringing in your ears? Any sort of ringing at all? Whether it be very minute or quite loud and powerful. Okay. Sometimes? Okay. Okay, good to know. Now, next question. Have you experienced any sort of dizziness or headaches since this problem has occurred? Okay. Just a little bit when... Alright. Got you there. Alright, now on to the next question here. So, have you had any other ear-related issues or problems at all really throughout your life? Anything else wrong with your ears that you ever experienced? Okay, see, this is about first time? Alright, interesting. So, if you know, has anyone in your family ever had any ear-related problems, issues, anything wrong with your hearing that you know of, anything at all? Just your... Okay. Do you know how, like, severe their problem was? Was it real bad? Was it not too bad? Okay. Okay. Now, next question here. How would you rate your hearing currently on a scale of 1 to 10? 1 being that it's quite bad and you can't even hear me at all, and 10 being that your hearing is perfect and that you have realistically no reason to be here. Okay. So generally right there, and then sometimes it's not as bad. Okay. But most of the time, alright. Alright, now this should be the last question here. How often would you say that you clean your ears? And what would you say that process is usually like for you? Just give me a quick rundown of what you do to clean your ears. Alright. And then okay. Yes, that is true. Q-tips generally aren't the right way to go unless you know what you're doing with them. Okay. It's just like a lot of things in life. You know, in the wrong hands, of course, it's not going to work that well. But if the right person has said item and knows what they're doing with it, they can use it properly or use it for multiple purposes and use it the right way. Okay, now that is about it with all the questions here. So I think I have a general gauge as to potentially what may be wrong, what may be off. Now, real quickly, I do want to do a quick hearing test before we start really examining your ears, just to get a more in-depth analysis of where your hearing is, just to get a little bit more of an accurate scale. Okay, so first things first, I'm just going to be whispering, saying some words. I'm going to go from soft-spoken to whispering, and then whispering to soft-spoken, and I'm going to just say different words, we'll start out loud and get quieter and quieter, and then I'm going to say the words quiet and then get louder as I go back. Alright? And I just want you to repeat each word to me after I say it. Got it? Now for this, I would prefer that you close your eyes just to ensure that you aren't reading my lips at all, and no cheating on this, okay? Alright, well then let's go ahead and start out. And of course also I could block my mouth a little bit so that you can't see. I'll do this. Okay, first word, I'm just going to say each word back to back, and after you repeat it back to me, I'll say the next one. So first word is craftsmanship. Next word, Congress. Inexact. Cosmetic. Enchant. Hesitant. Diminish. Misconduct. quintuplet, athletic. Okay, very good, very good. Now, next thing I'm going to do, just real quick, I'm going to give you some headphones here. And with these, I am just going to be playing a couple noises for you to listen to and just asking a couple things with them and asking you to do a couple things, okay? So first, let's get you headphones. Let me help you get these on real quick. Just sit a little bit still. And now tell me, how are those feeling right now? Feel alright? Good. They should be quite fluffy and comfortable. Now, what we're going to do next is a hearing test. We're going to be doing something I like to call the beep test, where I have these little beeps that are going to play. I'm going to play 2 at a time, and for the first set, I just want you to tell me which one is louder, which one is quieter. 1 or 2, louder or quieter. Alright, and as each beep plays, I'll put my finger up so you know that it just played, in case you might have missed it. Maybe it was a little too quiet, so you know that you missed it. Alright, and then actually real quick, let me go ahead and play just the beep by itself so that you know what it sounds like and what you're listening for, alright? It's not going to be different frequencies yet, but I will go ahead and play it for you. Alright, so listen out for this. Right there. Okay? Did you hear that? Good. So it's going to be that frequency, that pitch for the beep, and then it's just going to be different volumes for this first part. Okay? You ready to get started? Alright, let's get started here. First pair. 1, 2. Okay. Now which one was louder? 1 or 2? Very good, very good. Just like that. Easy peasy, right? Alright, on to the next one. 1 and 2. Very good, very good. Now tell me, which one was quieter out of those? Alright. Good stuff, good stuff. Alright. Next pair. 1 and 2. Okay. Real quick. So again, which one was quieter out of those 2? Okay. That's good. Good signs here. Alright. Next one must be the last one of this. 1 and 2. Alright. Now, which one was louder? Alright, very good. Now, we're going to switch it up just a little bit. Keep it simple still for now, though. It's going to be the same frequency beep, but instead this time it's either going to play in your left or right ear. Okay? Very good. It's going to be about the same volume. You're just listening for which ear, which side you hear it in, alright? So it'll be the same thing. Alright, so let's go ahead and get started. 1, 2. Alright. Now which one did you hear play in your left ear? Very good. And so the other played in the right. Alright. Next. 1 and 2. Okay. Very good. Now which played in the right ear? Nice. Okay. Let's move on to the next. 1 and 2. which played in the right ear. You're saying both of them? That both played in the right ear. Okay, very good. Yes, I didn't mention it to you just to make sure your ears were working properly and that you'd be able to notice the difference there. Both did play in the right ear. That is a possibility. Okay, on to the next one. This will be the last one. 1 and 2. Very good, very good. And so, which one played in the left ear? The second one. Alright. Very good, very good. Now, that is all we are going to do there for the hearing test. So let me put that back. Okay. Now, if you would, please just let me see the headphones again real quick. Don't worry. To finish this out, we're going to let you do all this again just to make sure your ears are working properly at the end of this. But let me just go ahead and there we go. And alright, here we go. Don't worry, you will most likely get a chance to use these again later, depending on if we do go through with the ear cleaning or not. But I think we probably will if you're not against it. Just to make sure that everything is a-okay there. Okay, let me put these down. Alright. Now, we're going to get into the hands-on portion here of the ear examination. So, I'm going to need to go ahead and get some of my things ready, but I am going to lay out the mat for you to lay onto horizontal, and I will be getting, like I said, my stuff ready. I'm gonna turn down the lights and everything, and I will see you in just a second, okay? So you lay down and I'm gonna go get my stuff. Alright. Alright. And it seems that you are in a bit more of a comfy position. You feeling alright? Okay. Okay, good, good, good. As long as you are comfortable, that is great, because I'm gonna need you to be comfy for this, alright? I need you to move as little as possible. And of course, I know I might look a little crazy, but to be a good doctor, you gotta be a little bit crazy, right? Yeah, okay, but not too crazy. So I'm just going to put on some gloves real quick. And then we'll get on to a bit more of an in-depth examination, alright? Okay. Alright. Very good, very good. Okay, so I'm going to draw on this light, and it shouldn't be too bright to the point where it hurts your eyes, but I'm not going to be really shining it directly into your face or anything like that anyway, so hopefully nothing is too bad. But I am going to turn on just to get a bit more of a bit of light. It is a bit dark in your ears and everything, so if you will, just sit still, and I am going to get a little bit close, okay? So just sit still. I'm going to come over here and just feel around your ears and let me know if anything hurts at all, okay? You said you clean your ears. Alright. And let me know if there is any pain as I'm feeling around. Okay. pull a little bit on your ear right here. Okay. I think I see. Alright, and nothing was hurting there? Good. Now tell me, if I were to just gently press in on your ear right here, like this, how does that feel? Doesn't hurt too bad? Okay. Now if I were to just tap a little bit, like this, how does that feel? Okay, not too bad, not too bad. Good. Now we're going to come over to this side, and again I'm going to get a bit close. Just sit still. I'll try to make this go by as painlessly and quickly and easy as possible. Still doing fine. Good, good. Now again, if I were to just tap on your ear like this, any pain at all? No? Okay. And again, if I were to just slowly push in just like this, how does that feel? Okay, okay. Alright, so I do think that our best course of action right here is going to go ahead and go through with that bit of ear cleaning. Okay? Your ears, as often as you say that you do clean them, I don't know if you're going through it the best way possible and truly as often as you should be. Okay? So definitely we're going to talk about that. What ways to properly clean out your ears, what ways may be a little bit easier at the end, but for now I'm going to go ahead and clean out your ears for you, and we're going to see if that helps out a little bit, alright? Cool. So, first things first, I just want to grab here a little cotton pad, okay? And I'm just going to put a little bit of a solution on this pad and just use that to wipe a little bit around the outside of your ear and to just make sure we clean it off. Alright. So here we go, right here. Just gonna put a bit on there. Just like that. Make sure we get it nice and wet. And we're just going to use this to clean out your ears. Alright. This should be good right here. Now, it may be a little bit cold when I first put it on, but you should adjust and it shouldn't be too bad. Okay? Alright, so again, sit still. We're going to start over here. Just sit back, relax, and stay as still as possible, okay? Now I am coming in. I'm going to get close, okay? Alright. It's a little cool, right? May tickle just a little bit. Don't worry, you'll be alright. Once you get used to it, it is perfectly fine. How does that feel? Okay. Can you hear that really well? Hey, that's already an improvement. And a good sign. Okay. Alright, I think that'll about do that ear. Don't need to go too crazy with it. This is more just a little bit of prep, per se. Now we're going to go on the other side. Okay. Now again, other side. It'll again be a bit cool. Maybe a bit more cool. But just sit still and bear with me, please, if you can. Alright. So let's get in on this side again. Get a little bit close here. Does it feel good? Okay. As long as it feels alright and you're sitting still, I've got no complaints. Just keep doing what you're doing. I'll keep doing what I'm doing, okay? Okay, let's get in. that. Alright, put that over there. So now I want to grab a little Q-tip real quick. Don't worry, it is clean. Grabbing it out of my special little bag right here. Alright, let's put that away. Now with the Q-tips, we're basically going to be doing the same thing, but we're going to be getting a bit more deep into your canal, and we're going to use the solution again just to soften things up around there. So it's going to get a little cool, and it's a little more sensitive in there, but if you could manage with that around the outside of your ear, I think you're going to be just alright with me going a bit further in, okay? Alright. And this part will really be quick, because I just need to kind of just coat around the inside a little bit and just make sure it's a little more moist in there. Alright, so we're actually going to start with this ear over here. So if you could just sit still, maybe turn your head just slightly towards me. Okay, very good, very good. So I'm going to go in here. How does that feel? You can manage, right? Okay, good, good. Alright. Like I said, this part is relatively quick. We don't need to do too much with this. Alright. Just go a little bit. Some twisty motions, and I think we're good. So now we're gonna go for the other ear here. Again, just a little dip in the solution. Okay. Now, again, if you want to just turn your head a slight bit this way, not too much, I'm going to go in now. I will say it seems like this ear is putting up a lot less resistance. Okay. How does that feel? A bit better, okay. Okay. And it looks like over here we are good. That side was a A little bit less resistance, but that is a-okay. We're going to treat both sides with care. So now that things are a bit more softened up in your ears and a bit more movable, a bit more less resistant per se, I am going to take out my handy dandy little tool here, and this I am going to use to scrape out some of the wax and stuff that is built up inside your ears. And I promise you I'll be gentle, and this process will not hurt at all, okay? But if anything does happen to feel a little off or like I went too far, you let me know, alright? Don't be afraid to tell me. So, I am going to take this, just get something to make sure, wipe it off every now and then. Alright, so you sit still, and let's just go ahead and start over here. Alright, so sit still, let me do this, and don't resist too much, okay? I'm gonna go ahead and go a little bit. How does that feel? Okay, good. That's all it's gonna be. Just gonna be scraping along the insides of your ears, making sure we clean everything out. Promise you this will be better for you in the end. Okay. I'm gonna try and get in pretty deep right here. So again, sit still. Okay. Okay. Is that feeling alright? So far, so good. Okay, yeah, that's good, that's good, that's good. Alright. You've made some good progress here on your right ear. So now we're going to take it over to the left, because I don't want to get too far ahead on one ear versus the other. So, same thing with this side. Although this side was a little less resistant, so may not have to go too crazy on this side, but sit still, okay? This side feels nice too. It'll feel nice either way whenever you're getting some of that stuff out. Okay. Gonna get a bit deeper in here on this one. Okay. Now let us shift back over this ear over here. All right. So just sit perfectly still like you've been doing. And hey, if you were to fall asleep during this, that's perfectly fine. I'll just wake you back up when we get to the last bit of hearing test, okay? I do think we are making great progress right now. It should be done in not too much longer, actually. think that this should be about it over here. Okay. I think that's good for that ear. So now we are going to move over to the last bit for this ear over here. Okay? Just keep sitting still for just a little bit longer, and then I'll let you get back up. I know as much as you'd like to just lay down here forever and just have me keep cleaning out your ear. It's not quite an option, unfortunately. Okay. Like I said earlier, this ear doesn't seem to be quite as bad. Okay. And your ear is looking quite a lot better. Does that feel right there? Good, good, good. Okay. I think this will be the last bit that I do right here. Okay. You are looking good in terms of your ears and in your ears, so let me put this away now. Last, I'm just going to just quickly take a dry cotton pad here and just pat down your ears, wipe around to make sure everything's nice and dry and comfortable for you. Okay, so just sit still. Okay, how's that feel? Good, good enough. Okay. And now just a little bit, almost dropped it, but I didn't. And now just a little bit over here. Okay. is all good, and that's all she wrote there for your ear cleaning today. See, process wasn't too bad, right? If anything, maybe it was a bit relaxing. Okay, I could tell. Seems like you were dozing off there for a second, but don't fall asleep just quite yet. We do have one more thing that we need to do. We need to do a little last hearing test to make sure that everything is all good there. And then I'll explain to you what I believe I found wrong and the best way to go about fixing it, okay? Alright, well, you go ahead and sit back and go back into the other room here. I'm going to clean up a little bit, and hopefully next time you see me, I won't have an indent in my forehead from this. But if so, like I said, sometimes it's okay to look a little crazy, alright? Okay, well, you go ahead and get up and go there. I'm going to clean up some of this stuff around here. Alright, and now we are back. Is the indent in my head too bad? Not too bad. Alright, so now we're just going to move on to a quick hearing test here to test out your ears once again and see if we did make some improvement and some progress upon your hearing. So first we're going to do the beep test again, but this time it's going to be a bit more difficult because we do really want to test and really get in depth with what we're testing here. So again, I will give you the headphones, and then I will explain what the differences are once again. Okay, so here they are. Alright, and you can hear me still, right? Just like last time. You hear me maybe a little bit better? Okay. So what's going to differentiate this portion of the beep test from the other one? First off, we're going to start off the same with two beeps, but this time they can be very different in terms of pitch. It's not going to be the same pitch this time. One could be higher, one could be lower. You never know. They can be in either your left or right ear, or they could also be at different volumes. So one can be very, very quiet, and then the other can be very loud. So this time you'll have to listen for the two beeps for all those differences, alright? Different pitches, different ears, or different volume. All three of those could be different. But just between the two, I just want you to list me off everything that you heard that was different between the two beeps, alright? Okay, think you're good on that? Think you're ready to get started? Alright, then let's go ahead and get started. And again, I'll put my fingers up when they both play. Here we go. 1, 2. Alright, and so what were all the differences that you heard between those? First one was in the left ear. Okay. Second one was a bit louder. And what about the pitch? They were both high pitched, but which one did one seem a little higher than the other? Okay, very good, very good. Easy peasy, right? On to the next one. 1, 2. Alright, so name me off all the differences for those two. Second one was a bit louder. First one was lower pitch, and then both were in the left ear. Alright, very good, very good. On to the next. 1 and 2. Okay. Now just name me everything that was different there. Good. Are you sure about that one? The first one was a bit... Alright, yep, a bit louder. Very good. And then it was right, left. Very good, very good. Alright, this will be the last one because then we're going to turn it up a little bit on the next set. But last pair of two. Go ahead and get started. 1 and 2. Very good, very good. So, just name me everything that was different. Okay. 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 That's all? That's right. Remember, it doesn't always have to be super different between the different beeps. I say different, but sometimes they can sound quite the same. It's up to your ears to discern and figure it out. Alright, now let's move on to the next part. And where it gets a little more difficult is this time, it's all the same things. You're going to be listening for differences between volume, pitch, and then also binaural, which ear. But this time it's going to be 3 beeps that play. So you're really going to have to listen in and try to remember, alright? Okay. You ready to get started? Let's go. 1, 2, and 3. Alright. So what was different there? And the first one and the third one sounded the same, but one was in the left, one was in the right, very good. And then the middle beep was dead center and sounded different in terms of what? It was a bit louder and a slight bit higher pitched. Okay, very good, very good. See, not too bad. Now let's move on to the next grouping. It's not a pair anymore. 1, 2, and 3. Alright, very good, very good. Now name me everything that was different there. Okay. And that one was a lot quieter. Alright, nice. Now let's move on to the last group of 3 here. I'm going to keep this part short. Let's go ahead and start. 1, 2, 3. Okay. Now what was different between those 3? Nothing. You're saying absolutely nothing was different. Like at all? Okay, well you are absolutely right. You're right, there was nothing different between those 3. It was the exact same beep 3 times over. Very good. Okay, well, that's going to end off the beep test there. Now, we're going to move on to the next part. Before that, let me go ahead and just take the headphones back from you real quick. Okay? Alright, and now we've got those. And, hopefully you enjoyed getting to use them. So now what we're going to do next is just whisper some words ear to ear. And I'm just going to whisper them very softly, some not as soft. And I just want you to, again, repeat the words back to me, alright? Okay, okay. And I'm going to whisper each word 2 times in each ear. So after I whisper it the second time, then repeat it back to me. Got it? Alright. Now I prefer if you, closed your eyes for this part. Or at least just don't read my lips. Okay? Alright. Well, then let's go ahead and get started. Cannot. Cannot. Sunfish. Sunfish. Gobble. Gobble. I think that'll about do it there. Yeah, very good, very good. And I'd say for the ending there, you did perfect actually with the beep test and with the whispering and repeating the words. I actually would say I do believe I noticed an improvement. So let me just type this in. Just get okay. All right. Now I'd say that maybe, or what I believe was going on, was that you just had a bit of impacted earwax and everything deep in your ear, and that may have been causing a bit of pain. Could lead to some chronic pain, which then leads to headaches, not getting the right kind of sleep. So I think what you should do, now that your ears are a little more clean, get some rest, and make sure that you get some sleep. Maybe take off for a little bit and just sit back and relax. You deserve it after having dealt with that for so long. And in terms of cleaning your ears, there's nothing wrong with how often you clean your ears or anything. I think maybe the method could just be a bit different. And what I'd say is get a almost little rubber syringes that have a little pad at the end. Get one of those and make a little solution of equal parts, right? Equal, even parts, water and hydrogen peroxide, and use that and put a little bit in your ear and just let that do its work in there, and then take a warm cloth or even just some tissue will work, and just wipe away at the stuff that comes out. Tilt your head back over, let the stuff come out, wipe away, and then after you finish with that and you think you've gotten a decent bit out, take some warm water then, and then put a little bit of warm water in there to rinse it all the way out, and then you should be good. And if hydrogen peroxide maybe doesn't work too well with you and it tends to maybe burn a little bit, you can also try a couple different oils. Like I believe baby oil works for some, or mineral oil should be pretty smooth, nice, and shouldn't hurt too bad on the skin. Okay, and just do that at least every day or two. But definitely don't let that go too long without it, because it's going to get harder and harder to get everything out of there. So just every day or two, make sure you're cleaning your ears out properly. You can still use Q-tips and stuff if you'd like, but just don't rely overly on them. Just do that if you feel like you need help going a bit deeper in there and getting stuff out. But otherwise, I think you're all good now. How do you feel, and how did you enjoy that experience? Okay, very good. I am glad that you enjoyed. It is my pleasure, was my pleasure taking care of you. And if you have any other issues that arise, do just come back, let me know, and I'll be happy and ecstatic, really, to take care of you again. I really liked having you as my patient. You were quite nice. Alright, so I will send you an email with the in-depths of what you will need to do. Okay, and I think that will about do it. Okay? Alright, and if you have any other questions, feel free to call me, or any other problems arise, also feel free to call me or let somebody know here. Alright? Again, I'm Jalen, It was my pleasure taking care of you, and I hope, maybe not hope to see you another time, but wouldn't mind seeing you another time, but I hope that you stay safe and get some good sleep, okay? Alright. Goodbye now.